Welcome to one more edition of Politics Done Right. My name is Egberto, Willies, your host. Today we are honored once again to have Dr. Chuck Pennacchio, the co-founder and president of OnePayerStates and the founder of Justice for All Network. Folks, he has a great piece of announcements today. First of all, Chuck, welcome to Politics Done Right. How are you doing today?
I'm doing great, Egberto. Thank you for having me again.
Well, look, this is important. As you know, healthcare is not just a pet peeve for many of us. We know that for the entire country, it is existential, and we also know that as the corporate control, as people start using our healthcare system as just a widget to make money for the few, it creates a big problem. You've been working very hard throughout this entire country in trying to establish some sort of a sensible healthcare system. Go ahead, first of all, and tell us a little bit about yourself to remind those who know you and to enlighten those who don't about the kind of work that you do.
Right. Yeah, just on background, I've been doing social justice work since I was really a kid, 13 years old. I'm now 64. I'm in that donut hole before Medicare. Worked on environmental issues, peace and justice, labor organizing, won a labor union at my last workplace, and got into healthcare after running for the U.S. Senate back in 2006 in Pennsylvania. And out of that race, and people said, gosh, Chuck, we're sorry you lost. And I say to people, we didn't lose. We built a movement. We built a statewide movement. And from that, we built a national movement, which gathers around this group we call OnePayerStates. And one payer is a reference to single payer, but it's a way of saying single payer without scaring people off because it's a trigger for so many people out there that they hear single payer. But one payer actually opens the conversation, and we can then explain to folks what the benefits are of creating a single payer, improved and expanded Medicare for all type system for the nation. Our group, OnePayerStates, we're a group of 25 states, a consortium of 25 states, working to adopt universal healthcare systems at the state or regional level. And our work has been enhanced by the recent introductions or reintroduction of a House bill by Ro Khanna, HR 6270. And Senator Ed Markey, for the first time, we have a Senate bill, a companion bill, same exact legislation is in the process of being introduced in the Senate side. We just picked up Elizabeth Warren as our first co-sponsor, so the bill is ready to be introduced in the next day or two. State-based Universal Healthcare Act, and what it's designed to do is to get the waivers. It's called a super waiver bill that will get money back to the states as well as legal protection. So I'm probably getting ahead of myself a little bit here, but I relocated to Washington, D.C. last September to work on this full time, and I have been for the last 6 months. We're making great headway. We have 29 co-sponsors on the House bill. And again, we're getting to work in the Senate. We just picked up Elizabeth Warren, and we have several more prospects, both in the Senate and the House. And our intention is to get this bill passed in the next Congress after the Democrats take power.
Excellent. Now, why don't you tell us a little bit about the intent of the bill? What do you want to accomplish with the bill? I don't imagine it's a full-fledged Medicare for all, but it's a new approach, a bite-wise approach that we're taking. So why don't you explain what it means what will it mean if passed?
Yeah, well, we often refer to it as Medicare for all through the states. The idea here is that the states model Medicare for all systems, single payer, universal health care, guaranteed health care for everyone, comprehensive, quality, where you get to choose your provider rather than being slammed by an insurance company. So it marginalizes the insurance companies, and it puts the patient back in the center of the conversation. The patient and the provider make the decision. So it's the same concept. In fact, Pramila Jayapal, who runs the National Medicare for All bill, previously ran this bill, this legislation. She loves this legislation. In fact, most people who study politics in the United States think that we're probably going to get to national Medicare for all through the adoption of it and modeling at the state or regional level. And this is, in fact, how Canada got to national Medicare through one province, Saskatchewan.
Yes.
So this is our theory of change. This is our organizing model, and we have a strategy to win.
Now, so tell me what does it entail? What are you gonna do? What specifically are they going to do in and maybe in a specific state that is ready to adapt it?
Okay, let's start with Oregon. Oregon is arguably the leading state in the country. It's a state with 8 congressional districts, which means it's about what, about 3.5 million people. We would prefer to have a larger state start out, but this is the state that's leading the way. And what Oregon will do very soon is be in a position to apply to the Health and Human Services Secretary as provided for with this legislation. They put an application to the Health and Human Services Secretary demonstrating that they've got the legislation to implement a universal healthcare system. And the legislation, the state-based universal healthcare system, Universal Healthcare Act, requires that states get to 95% coverage after 5 years and that they get to 100% coverage shortly after that. In order to do that, what the waivers would do, if the Health and Human Services, the secretary will set up a panel to vet these proposals, this legislation, to determine whether it's serious or not. Once it's approved, the waiver dollars will come back to the states, the federal dollars. So states pay into the national coffers, right? They pay into Medicare, Medicaid, children's insurance, federal employees, TRICARE for military.
Military.
So all of these monies will come back to the state, and the state will then create a pool, one pool. That's just the concept of single payer. You create an
Wow.
efficient one
Yes.
pool, and that administrative efficiency will allow the state to deliver universal health care cheaper, better, bring back communities, bring back hospitals. It's pro-business, it's pro-family, it's pro-schooling, because people currently pay a chunk of money in property taxes, and that money will disappear. They don't have to pay that money anymore, to property taxes that go to pay healthcare for school employees. This universal healthcare system will wrap around everybody. So the dollars will come back to the state, as well as what's called an ERISA waiver. This is getting a little bit in the weeds, but if folks want to
Oh
Google
no,
it,
I know the ERISA very well. In other words, that you don't need that anymore, actually. Go ahead.
Yeah, right. Well, what we want to do is get an ERISA waiver so that businesses are required to participate. So
Right.
this Employee Retirement Income Security Act that previously precluded states from meddling in any way with business benefits for their employees, including healthcare. So this is an
Hmm.
important provision of this
Right.
legislation. Yeah. So that's the design.
That is excellent because I mean, right now we have all these different pools of different health care, right?
Right.
When you talk about having the TRICARE, then Medicare, then Medicaid, and all these other things that have to be managed differently and have so many hands involved, you've removed all of that, pool all the money together. The state gets a waiver that allows them to do that and then ensure that every single citizen in that state has healthcare. Similar to Canada, you have one card that entitles you to healthcare and everybody gets it. Is that magical or what?
And every other country in the industrialized world, the advanced industrialized world, has got a universal healthcare system, some variation of single payer.
Right.
Every single one has got coverage for all of its citizens. We are the outlier, and our citizens suffer. We pay twice as much and get a fraction of what other countries get.
And Chuck, the magic is this: is doctors' bills go down. They no longer have to have all those employees in that office to figure out what insurance company they need to get, what insurance covered this, what insurance doesn't cover that. That's gone. No
Right.
longer do you have to have all these different entities that you have to get pre-qualifications for, etc. You have standards that you run by. The insurance companies, the profits that would normally go to the freeloaders and what we call the parasites are no longer there. So instead of having all that money go to things that don't control healthcare, we now bring all that money and it gives everybody healthcare without the overhead that we have that creates several CEOs, several databases, several presidents, several of all these other things gone.
Yep,
It's
absolutely.
and the patient gets to choose their doctor. their
Right,
hospital. The patient is in control with their doctor.
right.
Who can ask for more?
Yeah, publicly funded, mostly privately delivered, where you have that choice. That's the beauty of
Yes.
the system. It's a hybrid. In fact, anybody who is even a centrist or center right should adopt this because it makes sense. It's a fiscally responsible approach. It's the only fiscally responsible approach on the horizon right now here in the United States. The other thing that it does, well, it allows us to bulk purchase pharmaceutical drugs, right? So we can bring
Yeah.
down the cost of pharmaceuticals dramatically by pooling our resources and negotiating down the prices, much as the VA does, right?
Right.
Same thing with medical equipment. Medical equipment is the cost of it is through the roof. These MRIs, the cost
Hmm.
of an MRI in the United States is multiples higher than it is in Europe and Japan, way above, like
Let me
10 times.
I,
Yeah,
I want people to understand this, right? The MRI pricing and the pricing of all these things are psychological mumbo jumbo. If I am inside of a hospital and I look around and nobody is using the MRI machine, I could just go ahead and stick myself in there, ask a friend to turn it on, run this stuff off. It doesn't cost a damn thing other than electricity. But when you see it on your bill, it's thousands of dollars. My
right.
wife just had a kidney biopsy. The total cost was $27,000.
That's crazy, crazy,
Okay,
crazy. Yeah,
$27,000. Ozempic costs 89 cents to make. They sell it for $936. Whatever. WeGenic, which is a double dosage of Ozempic used for weight control. 1,300 plus dollars. How much does it cost? $4 to make.
wow. Yeah,
Okay.
that's nuts. That's nuts.
My friend, you are doing the supreme being's work in fighting for making sure that the average American citizen can have the health care that they want. And what it's important is for us to carry that narrative so that the insurance companies that are about to get on board to attack this, so that the drug companies that see the light that they won't be able to be parasitic on the people any longer. Don't
Absolutely.
get the hold on to the Americans. So it is important that you get your message out there, my brother Chuck Pennacchio.
Yeah. So what really, so you're really describing, we're describing here what I call the four horsemen from hell. And you can use that phrase if you want. The four horsemen from hell, big insurance, right? Big
Hmm.
pharma,
Hmm.
the big medical device industry,
Hmm.
and the big hospital industry. The
Hmm.
big hospitals are swallowing up all the independent docs, right? And we're losing contact. We're losing quality healthcare delivery because independent doctors it's struggle just to survive in this environment. So our system right now is becoming radically privatized. I think as folks probably know, but they need to know that Medicare right now is being radically privatized through the so-called Medicare,
Medicare Advantage.
but we call it Medicare disadvantage
Exactly.
because it doesn't it's on the face of it it looks great, it's affordable for almost for most folks, but when you actually need healthcare, good luck, good luck, you're in trouble.
I had a friend who just went through the whole scenario with Medicare Advantage, and you know what? The hospital says it's best for you to go back on traditional Medicare. You know what's the problem? Traditional Medicare, they by design only pays 80%, and they want you to pay the 20%. And when you go back, the Medigap that fixes that problem, which
Right,
is many times if you have a pre-existing condition, you have to go back through what's called reauthorization. You have to go back through the tables that determine what your risk profile is and
right.
makes it unaffordable. Folks, first of all, let me just here tell our audience a very important thing. Do not spend the extra money if you have it. Get Medicare, standard Medicare. Do not get Medicare Advantage, which is nothing more than a racket. It's nothing more than parasites trying to live off of the taxpayer dollars and not giving you care. Continue, please, Chuck.
Absolutely. Well, I mean, these are the action steps, right? Can we move into that, what we want folks
Yes,
to do?
please do.
Okay. Contact your members of Congress, the House of Representatives and ask them to get on with HR 6270. That's the state-based Universal Healthcare Act that's being run by Representative Ro Khanna. So HR 6270, state-based Universal Healthcare Act, and also contact your 2 U.S. senators at this point and ask them to sign on to get on board with Ed Markey, Senator Ed Markey's introduction of the same bill on the Senate side. We want this to be a resonance across Capitol Hill. We want this conversation to percolate up. This is a bill that actually has the prospect of passing in the short term in the next Congress, because depending on how you frame it and discuss it, as we've done today, it is fiscally conservative. It saves money. It costs less. And at the same time, it delivers quality, comprehensive health care. And why? Because, as you said, Egberto, it marginalizes the insurance companies. It gets these big hospitals out of the racket of consolidating practice and ramping up the costs on the patients that are coming through the door. It controls the costs of the medical equipment, and it brings all of this into synchronicity. And this is the kind of a healthcare system that we're after. So contact, the shorthand is 202, I think it's on your website, 202-224-3121. That's the Capitol Hill switchboard. Ask for your member of the House, your 2 senators, get on board with state-based Universal Healthcare Act. We're going to pass this after the Democrats win in the fall. The next year, we're going to pass this, and we're going to get states like Oregon, Washington, Minnesota, New York, Maine, Massachusetts, Pennsylvania, adopting these systems and modeling. And then the magic is that these states will then become magnets for businesses that want to come in and do business in an environment where they're not paying through the nose to get health care for their employees. They want to be in an environment where they can actually predict the costs year in and year out, so they can actually budget and invest. So this is really, it's a dynamic economic stimulus. It's a jobs creation bill beyond being a comprehensive healthcare provider for all of our citizens. It's going to keep doctors in the system. Many of them are frustrated and retiring early. A lot of young would-be doctors who want to get into it don't do it, or they get in thinking they want to be general practitioners, and they start looking at their medical bills piling up, their tuition bills, and then they don't go into general practice. They don't go into family medicine. They go into a specialty where they'll be able to pay down their bills. So that there's a shortage of primary care physicians because of the costs of healthcare and the way that it translates in terms of medical school. So all of these issues are interconnected, and we are doing, as you said, the critical work. We break out on healthcare, and we have the belief, once again, people then believe that we can do anything in this country. Go back to what John Kennedy said and said, we can light a torch for a new generation, and then connect our healthcare issues with all the health issues. And we look at the intersection of health issues, which is housing, policing, climate. Believe me, this is the vision that we have of a universal justice for all. This is the idea, is that we get healthcare, we bring all of the components of all the other health justice movements together, and we have the political power to win on every front.
Chuck Pennacchio, that is so important. And I want to add one corollary, and that is, imagine if businesses can concentrate on what they created their businesses for. They don't have to worry about their employees' health insurance, health care, because that belongs somewhere else. Imagine that. But anyway, let me tell you, Chuck, I always end this way. What would you like to say, or what didn't I ask that we need to get out there?
Well, I would just repeat the action steps at this point. This is why I'm here working on Capitol Hill. There are hundreds of lobbyists for all of these different medical industries. I am the designated single payer lobbyist in Washington, D.C. at this point. I mean, this is what OnePayerStates is committed to, is having a presence on Capitol Hill in Washington, D.C. for the first time ever, for a single payer organization, a Medicare for all organization, universal health care. And I need help. I need folks to pile on from the outside to resonate with the conversations and the lobbying I'm doing on the inside. So it has to be an inside-outside strategy, right?
And that telephone number again that they need to call for their senators and congresspeople?
202-224-3121. 202-224-3121.
And the
Capitol Hill
bill?
State-Based Universal Health Care Act. It's House Bill 6270. House Bill 6270. Once it's introduced, it will have a Senate number attached to it as well. But right now, you can still call your members of the Senate and House and get on board with the State-Based Universal Health Care Act.
Dr. Chuck Pennacchio, co-founder and president of OnePayerStates. Thank you so kindly for having been on Politics Done Right.
Thank you, brother. Appreciate you. All the work you do. Thank you.
We spend a lot of time deconstructing the news, trying to parse it into a form that everybody can understand. We try to find those little nitpicks where it flies above the fray, etc. If you really like these videos that we do, I want to ask a big favor. Please go ahead, number one, subscribe to our channel, and number two, please join if you can. Thank you so kindly for watching. Keep watching. Please remember to share. We must populate the entire internet with our progressive message, a message that we know is what most Americans say that they want. So help us, please join.